that I also ask that one of the pillars is the vaccine funding. When do you think any American who wants to get the shot will be able to get the shot?
Well, I'll try to answer the three parts of your question as I heard them. One, time is of the essence. Time is of the essence. And I must tell you, I'm reluctant to cherry pick and take out one or two items here and then have to go through it again, because these all are kind of, they go sort of hand in glove, each of these issues, number one. Number two, we are optimistic that we will have enough vaccine, and in very short order. As you know, we came in office without knowledge of how much vaccine was being held in abeyance or available. Now that we're here, we've been around a week or so, we now have that. And we've gotten commitments from some of the producers that they will, in fact, produce more vaccine in a relatively short period of time and then continue that down the road. So I'm quite confident that we will be in a position within the next 3 weeks or so to be vaccinating people at the range of 1 million a day or in excess of that. That is I promised that we would get at least 100 million vaccinations. That's not people, because sometimes you need more than one shot, the vaccination, but 100 million shots in people's arms of the vaccine. I think with the grace of God and the goodwill of the neighbor and the creek not rising, as the old saying goes, I think we may be able to get that to 1.5 million a day rather than 1 million a day. But we have to meet that goal of 1 million a day. And everything points that we're going to have, enough vaccine, B, enough syringes and all the paraphernalia needed to store, keep, inject, move into your arm the vaccine. 3, a number of vaccinators, people administering the vaccine, which is not an easy task. Of those who have those facilities, like the nursing homes and hospitals, they have people to do it, but they don't have the capacity to do everyone. And so I think we're going to have, we're leaning hard into areas where we produce more vaccinators. We feel confident we can do that. And thirdly, it's really important that we have the fora, the place, the facility, the circumstance where people can show up, stand in line, and get their vaccine without having to stand in line for 8 hours. Being able to pick up the phone, call the pharmacy, and get your name on the list, et cetera. All those mechanical things are really, they sound simple, but they're all consequential when we're trying to get out a minimum of 100 million vaccinations in 100 days and move in the direction where we are well beyond that in the next 100 days, so we can get to the point where we reach herd immunity in a country of over 300 million people. Does that answer your question?
Well, my question was at what date, or roughly when do you think anyone who wants one would be able to get it? Is it summer? Is it fall?
Oh, I know. I think it'll be this spring. I think we'll be able to do that this spring. And, but it's going to be a logistical challenge that exceeds anything we've ever tried in this country, but I think we can do that. I feel confident that by summer we're going to be well on our way to heading toward herd immunity and increasing the access for people who aren't on the the list, all the way going down to children, and how we deal with that. But I feel good about where we're going, and I think we can get it done.
Mr. President, one more vaccine.
Now, wait. I know he always asks me tough questions, and he always has an edge to them, but I like him anyway. So go ahead and ask the question.
Thank you, Mr. President. So you just said that you think within 3 weeks or so we'll be at the point where there are 1 million vaccines per day, but it seems like...
No, I think we'll get there before that. I said, I misspoke. I hope we'll be able to increase as we go on to get to the 1.5 million a day. That's my hope.
And then the follow-up to that would be, now that you're president and you're saying there's nothing we can do to change the trajectory of the pandemic in the next several months, what happened to 2 months ago when you were talking declaratively about I'm going to shut down the virus?
Well, I'm going to shut down the virus, but I never said I'd do it in 2 months. I said it took a long time to get here. It's going to take a long time to beat it. And so we have millions of people out there who have the virus. We're just, for the first day, I think, correct me if I'm wrong, I've been doing other things this morning, speaking with foreign leaders, but one of the things, I think this is one of the first days that the number has actually come down, the number of deaths and the number on a daily basis and the number of hospitalizations, et cetera. It's going to take time. It's going to take a heck of a lot of time. And we still have, as Dr. Fauci constantly points out, it's one thing when we have mass, how can I say it politely, mass disregard of the warnings about not wearing masks and wearing masks and social distancing and failure to social distance and people getting together on holidays in ways that weren't recommended, et cetera. We see, first thing that happens is we see the number of infections go up. Then you see the hospitalizations go up. Then you see the deaths go up. And so we're in this for a while. I mean, what are we now? At about 410,000 deaths? And there's going to be more. The prediction, as I said from the very beginning of getting here, after being sworn in, was the predictions were we're going to see somewhere between a total of 600,000 and 660,000 deaths before we begin to turn the corner in a major way. So, and again, remember, the vaccine, most of the people taking the vaccine, a vast significant number, require 2 shots, and they are an average of 3 weeks apart, and it takes time for it to be sure that you get to that 95% assurance rate. And so it's beginning to move, but I'm confident we will beat this. We will beat this, but we're still going to be talking about this in the summer. We're still going to be dealing with this issue in the early fall. And last point I'll make, and I know you're tired of hearing me saying it, particularly you may be tired of hearing me saying it, and that is that if we wear masks between now and the end of April, the experts tell us we can save 50,000 lives. 50,000 people otherwise would die. Thank you so very much.
Mr. President,